Welcome everyone to the webinar, and I wanted to personally thank Dr. Yair for the opportunity to set this meeting up and actually collectively meet our colleagues across this wide nation, if you will, and introduce ourselves as our fledgling research task force. And also, in echoing Dr. Yair's words, one of the challenges of research, one of the good things of research is it validates your profession. One of the challenges of research is its availability and accessibility in many ways. It becomes so complex sometimes that because of our work environment and we're busy with our daily lives, we may not have the opportunity to integrate that information and internalize it to create a message around it, a message that our patients, our colleagues, and our potential partners, if you will, can integrate as well and start cooperating with each other. So what I thought I would do is kind of set the stage this evening with a special presentation to introduce a tool that we could create. We've created at the RTF, an infographic, if you will, which is an evidence-based tool that can describe and demonstrate how pain can present itself as a doorway for opportunities for our profession. So when we look at the infographic, which will be available to you, it will have statistical information and background on pain. It can then provide a detailed medical and scientific understanding of the pain so that you can create a message around that, both for yourself, to educate yourself about the current scientific and medical understanding of pain and pain mechanism, and also how our profession can impact that industry, how our profession can contribute to that challenge. And also, in light of the shift of the paradigm, there is currently a paradigm shift occurring in how clinics and physicians address chronic pain specifically, because it's such a pervasive problem in today's global socioeconomic environment that a lot of a shift is occurring from the interdisciplinary reactive type of clinical setting to a more interdisciplinary proactive type of setting, where there is much more integration with other modalities, a multimodal approach to provide an overall care for the patient. So we'll address those as we go through. Now, as CDC indicated, about 1.5 billion of the population of the planet suffers from pain. That basically translates to 1 out of 5 of us in this presentation. 1 out of 5 of us suffers from some sort of pain, and about 34% of that can qualify as severe. Now, statistically, the infographic provides valuable information that proves the pervasiveness of this problem. Almost 70% of those with pain have to rely on some sort of opioid or OTC medication. And of those, 23% of them only find that effective in addressing their pain conditions. What's interesting, though, is about 40% of them have never even tried alternative therapies. Now, this highlights the lack of awareness for the solutions other than medication available for our patients. And it behooves us as physicians of traditional medicine to educate ourselves and ultimately educate our potential and existing clients about the benefits and values that acupuncture can bring and our profession can bring in contributing to this to the pain condition. Further research, interestingly, indicates that of those that do partake on alternative therapies, only 13% consider or have tried acupuncture as a modality. Now, this in itself presents a unique opportunity. A modest 8% increase can translate into substantial additional revenues for you and your constituent practitioners out there, for our fellow acupuncturists. So it's an important tool set that allows you to understand, assimilate, and then present this information to yourself, to your clients, to your clinics. The infographic also provides detailed summary, if you will, in presentable formats of what is pain and what is our current understanding of pain, from the normal nociceptive pain to the neurogenic pathological chronic type pain, and how inflammation plays a mediating role in those conditions, from your standard nociceptive pain to the generalized neurogenic pain that you see in more chronic conditions. It also provides you with a good detailed information of the stages of pain, how a pain from the first stage of transduction, the receptors carrying that signal through the spinal cord and the gateways within the brainstem, the thalamic and cortical regions, and how at various pain gates at these locations, modulation can be accomplished through either OTC drugs or intravenous drugs, through opioids, or in this case, through modulation through acupuncture, as you will see. And then finally, perception. So these tools can allow you to educate yourself and also your potential partners, integrative centers, and even your patients. Furthermore, the tool itself also provides very concise, very illustrated, in an illustrated way, backed by evidentiary data on, for example, how acupuncture effectively works in activating the pain gates through the inhibitory neurons in the descending neuron pathway, and thereby leveraging the alpha beta nerves, the larger scale nerves, for stimulation through acupuncture or manual therapy, electrostimulation, etc., and how that process activates the inhibitory sensors and reduces pain sensations. Also, how acupuncture, again, through evidentiary data, can show that it has an inhibitory effect and activating effect on the cranial 10th nerve, which is the vagus nerve, if you will, which has a direct impact across the entire body in terms of modulating and controlling the inflammatory processes. So that we call this pain relief without pain, if you will. Through auricular stimulation, we know very well, whoever studied acupuncture, that by activating the vagal tone, you can impart and stimulate the vagal tone and reduce inflammatory processes within the body. So these tool sets, if you will, are in the infographic for you to clip and paste, to use it in your presentations, learn and educate yourself. And all of this is based on research that you will see more of today, and also hopefully in the future months and years, RTF will continue to provide to you as interpreted data that you can then integrate into your own practice and also into your into further advancing our profession in the overall subject. All of that information ultimately ends up in small snippets, very key, concise snippets that you can use. You know, I could see any number of these snippets into a business card or even in a presentation as a placard in your front door, in your welcoming guest front door, reception area. And all of these are evidence-based backup that, for example, how acupuncture activates inhibited neurotransmitters, serotonin, enkephalin, norepinephrine, and how it downregulates the inflammatory process by stimulating the vagal nerve, and how it promotes tissue perfusion, how the various approaches of the modalities where treating an acute pain versus a chronic pain. Remember, acute pain is a symptom. A chronic pain is a disease, and you have to change your approach in therapeutic approach and modality approach in treating pain. And also more recent research which has shown that acupuncture can elevate nitric oxide levels, which plays a key role in modulating inflammatory processes in local tissues. All of these lead into one key element, and that is evidentiary proof exists that pain is a pervasive condition, as Dr. Yeri mentioned, and it plays a key role in the socioeconomic life today. And that has been shown that there is a demand for it. And there's also evidentiary data to back that acupuncture is a good option as a supplier for that. So in the parlance of demand and supply, the only thing that's left to do is really talk the talk and walk the walk. And this is where I believe RTF can provide value. Because as an organization, we can disseminate, integrate, and present unique evidentiary data, substantial clinical relevant data to you, to our constituent acupuncturists, on how to leverage that data, that research, into valuable messages that you can carry for your in your area, in your region, to your clients, to your patients, and to your partners. Education through these webinar series, through infographics, through presentation kits, interpretive research. There's just a recent research that was published on where a collaboration between the Beijing University and one of the U.S. Research centers identified the actual neuron that is involved at Zusan Li, stomach 36, that is actually conducting modulation of pain at the pain gateway. They were able to actually isolate the actual neuron and disprove that sham acupuncture did not work because that neuron is not involved. So interpreting that complex research into a simple, cohesive message that you can then put it on your business card, if you will, or put a placard out and post it on your window is one of our tools, I believe, that RTF can provide you. Not to mention opportunities for involving you and your constituents in unique research programs. There are several research opportunities that we're pursuing right now that would love to extend to globally to our community members to participate in these research. Because remember, ultimately, all research contributes to further advancing our profession. And just to kind of sidetrack here, all of our knowledge that we gain when we go to our acupuncture schools and our TCM schools, every wise word that we learned from the masters, from the Huangdi to the Qinbo, all of these, how do they get to us? It's through their research. It's through their collection of their data, nurturing that data, massaging it, and maintaining it, carrying it from generation to generation. Our profession is a heritage profession. And if we can value that heritage, we can further enhance its abilities. And ultimately, this, I believe, this unified approach will give us the opportunity to truly become integrated into the medical system of the world and become true component of overall patient care. So again, thank you very much for the opportunity to speak. I'd like to now open the door for our colleagues to continue the presentation. Thank you.